Hi, everyone, and welcome back to our Health Legacy podcast, presented by the First Ladies Health Initiative. I'm your host, Taylor Alston Cleveland. This podcast series was partially funded through Patient-Centered Outcomes Research Institute, or PCORI. The views shared by our guests are their own and do not necessarily represent the views of PCORI. Today, we're talking about postpartum hypertension and how tools like remote monitoring can support early detection. For many mothers, complications like high blood pressure develop after leaving the hospital, often without clear warning signs, and without follow-up care, they can quickly become emergencies. Research presented by PCORI shows that home blood pressure monitoring after childbirth improves early detection of postpartum hypertension, and it also strengthens postpartum follow-up care. So if these tools exist, what's preventing them from becoming standard care for every mother? Today, we're going to be exploring that, and we're going to also explore what it takes to make them more accessible. Today, I'm joined by some incredible women who bring clinical, faith-based community, and advocacy perspectives to this conversation. First, we have Cheryl Jackson. Cheryl is the CEO of Big Heart Health, a virtual healthcare company focused on expanding access to culturally competent care for everyone, including marginalized communities. Throughout her career, she's been a trailblazer, serving as the first woman and first African American in several leadership roles across the corporate and public sectors. Next up, we have Alexandra Symington. She is a healthcare leader focused on advancing community health and health equity. She previously served as the Director of Community Health for a large healthcare system where she led statewide initiatives addressing hypertension and maternal and infant mortality. And lastly, we have First Lady Tanisha Sims. She's a faith leader and the First Lady of Revelation Church of God in Christ in Los Angeles, California. With over 30 years of praise and worship, she has impacted countless lives through her ministry and through her leadership, supporting women and families through life transitions, including motherhood and postpartum. Thank you, ladies, for joining us today. We're going to have a conversation really focused on home healthcare monitoring and telehealth support and how it affects maternal health. And so I want to start with you, Alex. Many mothers leave the hospital thinking that, they're clear after delivery, but we know that that's really not the case. Can you talk a little bit about why that postpartum period, especially after they leave the hospital, is so critical for new moms? And can you also share the importance of monitoring their blood pressure during that period as well?
Yes, it's a great question. And I think one of the reasons why that postpartum period is so critical is that's when they're especially susceptible to hypertension and hypertensive crises. And oftentimes there is a health literacy gap where women don't even know what the symptoms are, and they may seem like a headache or swelling that is associated with pregnancy. And so you don't realize that there is actually a serious problem happening. And during pregnancy, especially leading up to delivery, there's frequent visits with your doctor, and then once you deliver, the visits are less frequent, and often women are not attending or can't attend their postpartum visits, which is critical because that's when you're getting, checked on with your doctor. And so I think there's a lot of reasons why women aren't able to make those appointments. Oftentimes they're prioritizing the baby's appointments, or there could be transportation gaps and a number of other factors. So it is really critical that home monitoring is in place, and that the women, as they're going home to care for their babies, are also taught how to care for themselves and what to look for.
That's really great. I think that overall, we're seeing the healthcare landscape change so rapidly because of everything that you just said. With the introduction of telehealth and remote monitoring tools, how can these innovations really help close that gap, especially for moms, like you said, who may be dealing with those social determinants of health, like transportation, maybe their work schedules or childcare? How can these innovations really help close that gap?
Yes, technology can really help close disparity gaps if they're designed for the user with the lowest access. We can't assume that everyone has the latest smartphone and they're going to be able to download this app and it's going to help with their healthcare. You have to really understand what the patient's barriers are. So the first step is for healthcare systems to conduct social determinants of health screening to understand what barriers that patient might be facing. Maybe they have a phone that's not a smartphone, and so how do we adapt our process to accommodate that patient? And so that's one thing that healthcare systems can do. And what we're also seeing with healthcare systems is expansion of the healthcare team. So often a community health worker is in place to support that patient who comes from a socioeconomic background where there's limitations. And that community health worker can provide resources, emotional support, and potentially even home visits to help monitor that patient postpartum. So I think those are some things that can be done. And then, of course, as the healthcare system providing the tools necessary for patients, we can't expect patients to go out and buy their own blood pressure cuffs. And often, if you buy it, is it a brand? Is it the right brand? Has it been calibrated? So these are things that are important for healthcare systems to keep in mind. And so if they can provide the device to the patient along with training, that's really the best practice.
I love that. Cheryl, I actually have a question for you now that we're on that topic, because I know with Big Heart Health, I definitely want you to share a little bit more about that, but there's an integration with community health workers as well. So can you talk a little bit about just Big Heart Health and how telehealth companies help close those gaps?
Thank you for having me here. And yes, I'm CEO of Big Heart Health. It's a virtual healthcare company. So we do a lot of telehealth, but we also do other things like supporting patients in addressing social determinants of care, but also educating patients. Oftentimes, in our role in the work that we do, we first have to establish what good health is. Sometimes we aren't aware. I think you spoke about this, Alec, that you can feel better, that this state of being isn't normal for good health. In our communities, particularly, we have normalized not feeling well. So education is key. We also include community health workers. We call them community engagement specialists, but they're kind of the quarterback of the care team for our patients. So they're proactively calling by phone these patients. They're meeting with them every month. They're helping create or manage their care plans with their providers and with that patient. But really, the role is to establish trust between that person and the patient and the member. Once that trust is established, you can really work together to come up with a plan and hit the goals for that patient. I think the movement really is moving toward home-centered care. Mm-hmm. You see that in so many instances, whether it's Amazon and their launch of their pharmacy. Yep. And telehealth, honestly, to Big Heart Health, where we not only are providing telehealth, but education and addressing social determinants of health. And we do this by partnering with churches and other social service agencies, because that's where people are. That's who they trust and know. These organizations have a lot of built up trust with these members. So that's important. We know that remote patient monitoring is an important tool. But it starts with education, making certain that patient understands how to use the tools, that they're using them, to record their statistics and their vitals. And it's particularly important, I think, critical for women who are postpartum, not only from to avoid a hypertensive crisis or to manage their hypertension, but to manage their mental health as well. We know that's a big part of the postpartum care. And to do it from the convenience of their home. Their lives are sort of blown up by this new baby that is fully dependent on them. Oftentimes, mothers have other children that they're caring for. So there's a lot going on at home, and to expect someone, particularly after delivering, to go to doctor's appointments, leave their home, manage manage childcare for the other children is a lot. So this is a highly convenient tool that meets that mother and other patients right where they are.
I love that. First Lady Tanisha.
Yes, ma'am.
So Cheryl mentioned the importance of partnering with churches. Could you share a little bit about why sort of that church partnerships with medical providers is so important? What have you seen from your own experience regarding sort of using sort of the church as an opportunity to help close those gaps?
Well, thank you so much for having me again. And I am super excited to be here with you, lovely ladies. How the church and the partnerships with these industries are important because one thing that Dr. Soni, I think she did a podcast with you guys before, and I was so enamored with her wealth of information. But one thing that she talked about was community and the reasons why certain women or us, why we don't go to our doctor's appointments is because of community. And what she meant by that was when you have a provider who doesn't look like you, most times we don't feel like we can trust them. We don't feel like they understand us. And so when the church can share providers that are in our community that can help you get to that next point, that can help you with your future, I have seen with my eyes success. And she talked about that. There are so many gaps in disparities because of community. And so what my husband and I are doing is connecting with different partnerships, not only just in healthcare, but specifically for this conversation in healthcare, so that we can see a success in the healthcare with our community, and they are not alone. There's one member of our church that literally asked us to come to a doctor's appointment with her because she was afraid to go into an elevator and just different things. You never know what people go through. And so just to know that she trusts us enough to come with her to a doctor's appointment, I think telehealth would be more beneficial for her rather than her trying to drive, which she's afraid of driving as well. So just these little things, these partnerships are so imperative to healthcare, period.
I love that story. Can each of you all share a moment where in your work and in the work that you're doing in the community where you saw how maybe a lack of access affected someone's health, a mother's health?
Well, I would share a story how that patient-provider racial concordance, that's what you're talking about. When someone shares your experience, your lived experience, someone who looks like you, it can provide better support. We know the data bears this out, right, Alec, that babies, Black babies, are more likely to live, have higher chances of survival when they are seen by Black physicians, as well as the Black maternal mortality rate is better addressed when seen by providers that look like them. In this one particular instance, actually, she was a community engagement specialist for us. She had an experience where she went, she was pregnant at the time. This is before she joined our company. She was pregnant at the time, and she wasn't feeling well. Our mother encouraged her to go to the doctor. She went to a physician downtown Chicago. I won't say the the hospital, but you all can connect the dots. Is one of the biggest healthcare systems in Chicago. She said that she went in. This was not her first baby, so it wasn't her first rodeo. Yeah. She knew what was happening to her body, and the doctor sort of was dismissive. She said he didn't even touch her. Told her that it probably was gas, and she said, "This isn't it. This is not my first child. This feels different." He was dismissive, and the visit lasted less than 10 minutes. Didn't touch her to examine her or anything. She left. But thank God for a praying mother. Her mother's like, no. You go back. And she sent her to the county hospital. And she saw a Black OB-GYN. And in fact, it was not gas. Her appendix was about to burst. And so this mother, this Black OB-GYN said, trusted her, your body. So let's take a look to see what's going on. Ran more tests. And that was the outcome. She helped save her life and the baby's life.
Thank you, God.
So that's just one example of that racial, that patient-provider concordance. When someone who shares your lived experience sees you and hears you and supports you. Yes. But we've seen this with telehealth, the convenience of accessing your doctor. You're more likely to be engaged in preventive care, which is really the holy grail, is preventive care. Oftentimes we focus on our health when it's in crisis.
Correct.
But the best way to have better health outcomes for you and the baby is preventive care. So telehealth does that. So we'll call the house and for maybe speak to the mother, and because it's so easy, she's like, "Can my children? Will you see them? Do you all see children via telehealth?" We said yes. She signed up her entire family because it's convenient, and also that critical role of that community engagement specialist, that virtual community health worker that really knows how to support and talk to members can be the difference between, going to an emergency hospital visit or not.
Yeah. I have a story about myself, actually. For my first child, my OB actually was Black. She was mixed, but she was Black, and she didn't have any children. But I knew, and I don't know if it was because just the type of person that I was, I came with questions every single time. I knew I was paying for my health care because I had PPO at the time, and I was paying a pretty penny for health care. And so I wanted to get everything out of this visit that I could. That was one thing that she did not share with me, and that was postpartum depression. And I know we're talking about hypertension, but this is, the story based on the lack of, right? And so she didn't share that with me. However, when I brought my baby home, my mother-in-law was there to visit. And as she held the baby, she told me, she said, postpartum depression is real. And if it comes, you're going to be okay. And when she told me that, I said, okay. I'd heard about it, maybe in a movie or something, but no one had ever talked to me about it, right? Mental health wasn't a big boom in 2009. And so it hit. And when it hit, I said, okay, it's here. I cried myself through it, but I heard her in my head and I said, it's here and I'm going to be okay. And that is the testament to how community can show up for you, not only just providing resources, but just sharing those oral traditions that really make up a society. Oral traditions are so important. And so now I pay it forward, right? I share those stories that I've gone through that no one shared with me, that I didn't expect anyone, or that I don't expect anyone like a physician to share with those mothers who are completely clueless and are only told to take prenatal vitamins and drink water, right?
Yes.
Wow. Thank you both for sharing those stories. I think a common theme is advocacy. You had an advocate in your mother-in-law, and then in the story that you shared, the patient had an advocate in her mother, and that's so important. And I think in my experience, there's been several cases in Indiana where women have been denied care, they're not listened to, they're turned away, and it has resulted in fatalities. And it's horrible. It's preventable. And so any time that you can save a life, I mean, why are we not checking someone out? Why are we not at least like bringing them into the exam room? So I think it's a huge issue. And I mean, in my previous role, I would see a lot of patients or hear from a lot of patients who lacked access to care, who lacked transportation. They didn't feel like they could trust their providers. The providers aren't even asking the questions, first of all. And there can be shame associated with your living situation. If you are unhoused, or if you are facing eviction, you don't have access to a car, that there's a level of shame associated with that. And, your basic needs are often not met. And of course, that's going to have health outcomes, impact your health outcomes. So yes, lots of examples, unfortunately, of people who are not they don't have access to the resources and tools and knowledge that is needed in order to have a successful pregnancy, delivery, and postpartum journey.
Yes.
And can I say, I also remember like going to these doctor's appointments, even pediatric doctor's appointments, and having to fill out those forms, questionnaires about living conditions and habits and whatnot. And so to have to expose if you are not living in the conditions that are that society deems appropriate, now I have the fear: am I going to lose my child?
Yes, that's
and,
very real.
it's just so many things that keep us from being in the spaces that we need to for our own benefit, because we're afraid of the system that may crush our lives. Just because I had to answer a question honestly.
You do feel a lot of judgment in those situations. And not only are you asked once, but you're asked a lot depending on what system you're in or hospital you're going to. Even within the same system, you could be asked at different points in time. So that in and of itself can be frustrating. Like I've already told you, and here you are asking me yet again. And each time it just makes it harder for the patient to connect with the providers and really be transparent.
So Alex, I know that you've worked on really large-scale maternal health programs. What gaps in postpartum monitoring have you seen in the healthcare system?
Yes. So I think one of the gaps that we talked a little bit about is that in order for this type of program to work, it does require investment. So healthcare systems are going to have to invest in the devices to provide patients and also the training to offer patients. And I think the culturally competent training is really important, and that's not something that always happens. Again, for the reasons we've already discussed, there's not a foundation of trust there. But the way information is delivered can impact how you receive it and if it actually resonates and if you're learning the information. So that's where the community health workers really come into play as a partner to help bridge that gap of trust and understanding. So I think that's key. And then in terms of the home monitoring piece, that adds so much value because it provides more clinical touch points. You're at home, you're able to take your blood pressure, and that ideally is fed back to your healthcare system, connected through the EMR, and there's someone on the other end who has a clinical background monitoring your outcomes. If your blood pressure is too high, you'll get a notification to, wait 10 minutes, check it again. If it's still elevated, here's what you need to do. So it'll prompt you on the steps that you can take. And I think that is, again, super important because if you don't have that in place, you're home experiencing these symptoms, you're blood pressure is getting worse, your symptoms are getting worse, you don't know what you don't know, and you don't know that it's a problem and how to move forward. So those types of programs are very important and can help save lives.
Absolutely. Research shows that home blood pressure monitoring overall after delivery can actually improve early detection of postpartum hypertension.
Yes.
And so what needs to happen for these tools to become standard, right? Because I think that there's this lack, and we had an episode solely focused on home or just hypertension overall and addressing things like preeclampsia. But knowing that you have to, it's so important to monitor your blood pressure after you give birth. Can you just shed a little bit of light into that, and also shed some light into ways that, and maybe any of you all can answer this, how can we make this standard across the board? It should be required for all mothers across the board.
So I think hypertension is known as the silent killer. And I just wanted to call that out because, again, some of the symptoms may not seem like life-threatening. But in terms of how to standardize, I do think a default approach is helpful. So let's assume everyone needs to know this information when they're postpartum. Let's assume everyone should go home with a blood pressure cuff, especially those who are at higher risk, which is going to be Black women, and make sure that the training is embedded into the workflow for the nurses and the hospital staff. That is just essential, and there's ways that it can be done, and we've seen, even during the COVID days, how quickly processes changed and how procedures changed, and how quickly solutions were implemented. So we know that rapid evolution is possible, and we can implement these types of things to save lives. And so I think that's going to be key, is just the operational aspect of it, making sure that there are partnerships with community health workers, that, there is an opportunity for us to provide realistic goals for our patients, like provide realistic instructions, right? So if I'm sending you home and providing you a blood pressure cuff, have I done the training? Do you know how to use it? Do you understand, what the next steps are going to be depending on where your range is, what your range is on a daily basis? And am I also providing you with the resources to make sure that any gaps are addressed?
I think funding is going to be important. And funding follows legislation.
Yes.
And so laws need to change. And the only way that happens is through advocacy, which is why I believe churches are really powerful. Because we need more voices, more aggregated voices, speaking collectively in community, in unity. So having churches, which is why I love the First Lady's initiative, having churches step into the arena, the healthcare arena, and become part of that care team of families and Black families. Because when you look at the disparity gaps, we're at the bottom. Our founder for Big Heart Health says often that Black people get the least of the best and the most of the worst. And the data bears that out. When you look at disparity gaps, we're at the bottom. And then at the bottom of the bottom are Black women. So we need the church, which is where Black women are, but church leadership to not think of healthcare as someone else's problem, hospitals, that the healthcare industry, but to bring that in-house and become not only advocates, but delivery systems, mechanism, channels to deliver healthcare to the people that they're shepherding and supporting. So funding follows laws, and having this be mandatory, whether you're on Medicaid or private insurance, because we know that the maternal health statistics impact women, Black women, up and down the social economic. It does not matter, from the Serenas and the Beyoncés to Shaniqua. Okay, so it's up and down the social economic system. So this has got to be a default requirement for private insurance, commercial insurance, as well as Medicaid. So funding follows laws. We need to change laws, and I think the church is aptly positioned well to help drive that advocacy.
I totally agree with that. It's really getting them to check on themselves, right? Because the hospital doesn't know you're pregnant unless you're going to tell them that you're pregnant, right? It's it's changing the narrative of what healthcare looks like versus what healthcare looked like for our parents, maybe even for the baby boomers, where there had been experiments that they didn't know that they were subjects of. So now, and I hear this all the time from my mother, I don't trust my doctors. I don't trust my doctors. She has high blood pressure that she's getting a handle on right now. And I think it's so important for us as the church to make sure that we are able to share and partner with those that we do trust.
Yes.
I'm grateful that in California we do have a quorum of doctors that we trust, that we can tell our constituents to go to and know that they are in good hands. I'm grateful that I'm in good hands with my African-American doctor. But yes, I think that being an advocate through the church to just get them there and get them to the right person that's going to care for them and understand what they're going through, what their disparities are, what they're feeling, and letting them know that, hey, I validate you. I validate what you're feeling and the things that you need to take care of for your body.
And I just want to, go ahead.
Go right ahead.
I was just going to say, I'm so glad you brought up funding, because that is critically important. And in fact, my former healthcare system relied solely on grant funding to be able to implement the community health program as well as the blood pressure cuff home monitoring program. And so, public sector, private sector, everyone has to come together to solve this issue. And I think the other piece that I would highlight, and you brought this up as well in terms of statistics, if it's not measured, it's not managed. And so this has to be a metric that is on the scorecards for all of these healthcare systems. If you were to prioritize infant and maternal health within a healthcare system and stratify the data, you will see that it is Black women and Black babies who are disproportionately at risk. And then from there, dig into the why. And oftentimes, blood pressure is going to be a major contributing factor. So I think including this on the scorecards from an operational standpoint is what can help drive the standardization, and also relying on funding from different sources.
So in practical terms, this is what this means. The next time an elected official shows up at church,
Come on.
okay, wanting to talk to your constituents,
Yep.
We need that pastor, we need that first lady to say, where are you on health care
Yes.
and funding and issues that impact Black families, Black women? Because guess what? Look at that audience. It's mostly Black women.
Come on.
So we need pastor, okay, to have this to be a priority. The next time this elected official rolls up,
It's coming up.
it's right. It's coming up. They come. So really being on the front line, that would be so refreshing to see the Black church to champion in a powerful way, legislation, or advocate for legislation and legislative changes that impact the health of Black women, since Black women are writing the checks for Black churches.
Amen.
Well, and you saw the impact of the Target boycott, which was started
Yes, sure
in the
did.
church.
In the church.
Look at the impact, right? And so
Every major movement happens
Exactly.
through the church.
Through the church.
exactly.
Oh, yeah.
And so that this movement needs to be, and this is what Big Heart's been pushing, claim your right to good health. Notice I didn't say
love
health
that.
care. I said health. It is a God-given right to feel good in your body.
Your temple.
Your temple.
Come on.
Amen. Your temple. And to have the church be on the forefront of driving that movement,
Yes.
helping our people claim their God-given right to good health is, I think, a game changer.
I agree.
And I dare say the next stage of the civil rights movement is health.
Yes, it is.
Amen.
Yes.
Amen.
Amen.
So, Alex, you talked a little bit about COVID and how it kind of shifted how we think about addressing healthcare. Cheryl, I would love to hear about how COVID really accelerated telehealth. Could you share a little bit more about that?
Absolutely. Before COVID, we were on a struggle bus, okay? It was a struggle fest trying to get people to adapt to telehealth platforms. Doctors wouldn't use it, hospital systems. It was just low adoption. Then COVID hit, and it was a lifeline and a lifesaver. It turbocharged what was going to happen eventually, but that crisis turbocharged this evolution, the shift in our society. So we saw that before COVID, we were mostly you call it SaaS, software as solution, just licensing the platform. It was in COVID when we got in the business of delivering care, mostly because we saw our people dying at high rates. And it really compelled us to get into the delivery of that. But this is technology. The other thing that happened that helped to accelerate the adoption of telehealth is that the rules changed, the federal rules and what got reimbursed. So before, they weren't reimbursing for telehealth visits. So that rule got relaxed. Then there was the compacts. So if you're a therapist or provider in one state, you could become part of a compact to provide care in other states. So telehealth, you can access that anywhere, access providers anywhere. But the rules were sort of limiting, because we have a provider shortage. So they had to loosen those rules, okay? So they loosened the reimbursement rules. They loosened the licensure rules to increase the number of available providers to tap access. So good news is that by and large, the reimbursement for telehealth has stayed. By and large, certainly in Illinois, the state, our governor made that a standing rule. So thankfully, we hope many other states would adopt this, but for the large part, most states have adopted that. But we saw COVID. We know that systems and rules can change.
Absolutely.
Quickly.
Okay, quickly. We
right.
see that. And going back to advocacy, having the church, using our collective voice, push for those kinds of changes, it's going to be critical. It's going to be a game changer.
Yeah.
On that note of around pushing for change, what role could families, churches, health providers all play collectively to make sure that no mother is left behind?
Well, I think as it relates to the church, to community leaders, I think getting them to understand who they are and whose they are, and to stand up and understand that everything that they do now has to do with your future. And if you're not making the right decisions now, it can affect your future. And so getting that narrative out, building the people up to understand that they have to be their own advocate for their health. And we talked about the temple. And this temple, what we believe is the temple of God. And everything that you put in has to be good versus something that is not good for your body, as we present our bodies as living sacrifices to God. And so making sure that how you treat yourself is directly affected to your future. And so making the right decisions, having we have retreats, we have women's retreats for the churches, we have conferences and things. And so bringing and I'm seeing this across the board in churches in the national sense, we're bringing the mental health professionals in, we're bringing the doctors in, and we're asking questions because we need to know it's not just what the scripture says, but how can we bridge what the scripture says with what healthcare is offering us, and to do better for yourself.
I like what you said in terms of empowering people, because I think ultimately that's the role that we can play. I think the education piece, informing people how they can advocate for themselves, and making sure that everyone knows kind of what to expect, right? When you're pregnant and, going through your journey postpartum, knowing what to expect makes a big difference.
Correct.
I just lost my train of thought. Oh my gosh. Sorry. All right. Cheryl, do you have anything?
Sure. Okay, two things. One, I need the ladies to get in their group chats.
Yeah.
Okay.
Yes.
And say,
I love that.
Listen, this is important. If taking care of yourself postpartum, this is important. Make this a priority. Make you a priority. And getting the word out, using your agency and your girlfriend group to spread the word. So get in your group chat and spread the word about the power of good postpartum care and the need for it. Then I need churches. You're not just a place of worship for spiritual healing. You're a place, a center, a hub for physical healing, for emotional and mental healing. So you can actually have a medical center in your church using telehealth. So when people come to Bible class on Wednesday nights, they can check in with their doctor via telehealth at the church, because maybe they need some extra support logging on. Maybe they don't have a smartphone. Maybe they are older and need that. When they come to church, you can also check in with your doctor via telehealth, because you can partner with Big Heart Health.
I love that. I love that.
I'm just saying.
I love that.
Those are my two takeaways.
Yeah.
Thank you for that. I totally agree. I think the other comment I was going to make is, similarly, I think you mentioned this before, where the risk for Black women is there irrespective of your socioeconomic status. And so having the education and the knowledge in terms of how to advocate for yourself is critically important. And then looking at the organizations that you're a part of, I think it's very common for Black women to be very involved in the communities, whether it's a Divine Nine organization or an organization like the Links, and thinking through how can I corral my group, mobilize my groups towards an impact, which is infant and maternal health. Like, how can we focus our efforts collectively to drive change in our communities?
Exactly. Couldn't agree more with that.
I love that group chat.
Get in your group chat.
Everybody,
We love
get your group chats together.
Right.
Well, thank you all so much. This was such an amazing conversation. I learned a ton from you all, and I know our listeners will too. So,
Thank you.
Thank you.
Thank you.
We would like to send a heartfelt thank you to each of our panelists for this crucial and candid discussion. For more resources and ways to engage, visit us at firstladieshealth.com/maternal health. And also help us amplify these voices by sharing this episode with someone who needs to hear it. You can connect with us on social media by following us at First Ladies Initiative on Instagram. This podcast was partially funded through Patient-Centered Outcomes Research Institute, also known as PCORI, Dissemination Award. The views, statements, and opinions presented in this podcast are solely the responsibility of the speakers and do not necessarily represent the views of PCORI.